pronouns she, her, and hers, and I am the Public Health Director for the Oregon Health Authority. Dr. Cieslak will introduce herself a while later, but we just wanted to tell you we're so excited to be with you all here today talking about COVID-19 and some great hope that we have in terms of vaccines. But before that, I'm going to start out giving us an overview of the numbers. Unfortunately, Oregon is still right in the middle of our surge in COVID-19 cases. And so this means in terms of our daily new COVID-19 cases, we've been in the 4 digits or quadruple digits really since mid to early November. And on December 4th, unfortunately, we saw our state's highest ever daily COVID-19 count when we reported 2,176 cases. I have to say, this part of my job that I'm about to share is the part that I hate the most. And that is talking to you all about COVID-19 deaths and reporting those deaths. We've seen double digits in our daily COVID-19 death counts. And on Tuesday of this week, we recorded our highest ever death count in one day at 54 deaths. And I say this is the part I hate about my job. I think back to the first death when I worked locally in Multnomah County, and in our emergency operations center, we all were just devastated. And all of these months into the pandemic, it doesn't get any easier. And we still mourn with the families and grieve and send our love and condolences and say that we are trying as hard as we can so that we don't have to have not one single additional COVID-19 death. Another concern and is hospitalizations, and in the number of hospitalizations that we're seeing across Oregon, we reported that Wednesday it was 554, which is higher than the day before, which we look at what's the daily count, is that higher or lower than the day before. And in terms of intensive care unit beds, it was 113, which is also higher than the day before. I do want to say, while our daily cases remain high, they've somewhat leveled off, and that is makes us cautiously optimistic, and really want to give gratitude to all of you all who've masked up, who changed your holiday Thanksgiving plans if you celebrated Thanksgiving, had smaller gatherings. We think all of those things are making a difference, and we want to continue seeing those things into the next holiday. We know that this is holiday season. It's not over, and we know that the upcoming and current holidays bring potential for increased COVID-19 cases, and we feel like with the vaccine here, we have light at the end of the tunnel. We just need to keep going. And so we're asking you all, thanking you all, and asking you all to keep going with the things that we've been doing, keep going with masking, keep going with small gatherings, keep going with that physical distance, keep going with connecting socially, virtually, somehow. We know that if we do see a jump in cases and then what lags is hospitalizations, that could really bring our hospitals to the verge of not being able to care for any of us if we needed to go to the hospital, either because of COVID-19 or anything else. And that's what we've worked so hard to avoid. And once again, just urge you all and thank you all for keeping going. Last but not least, I want to talk about the unfair and disproportionate, uneven rates of COVID-19 that we see across our state. And those are called health inequities. They're not natural, they're not just. We can change them. And we've seen these disparities in our Black, Indigenous, people of color, and tribal communities across Oregon, where we see Pacific Islanders, Native Americans, Alaskan Natives, Black, African American, African immigrants, and other in our Latinx communities who've had higher rates than other folks. And that, once again, is not natural. It's not because the virus likes some people better than others. It's because of workplace exposures and also unfair access to care. So with that, I'm going to turn it over to Paul, who's going to talk more about what we know with the vaccine.
Hi, thank you. I'm Dr. Paul Cieslak. My regular job is as Medical Director of Communicable Diseases and Immunizations here at the Oregon Health Authority's Public Health Division. During the COVID-19 pandemic, I'm serving as one of several senior health advisors. So the good news is that this week we got some of our first doses of the Pfizer-BioNTech vaccine. This is one of 2 mRNA vaccines that have recently been produced. And we began administering it through 5 provider sites, including Oregon Health and Science University, Kaiser Permanente, Legacy Health, and St. Alphonsus. We're expecting to receive a total of 35,100 doses this week, with the first shipments from that batch, almost 5,000 doses, 4,875 doses going to those health systems. Of this week's federal vaccine allotment, 10,725 doses are being sent to pharmacies. They will be serving our skilled nursing facilities as part of a federal partnership with pharmaceutical chains, CVS, Walgreens, and Consonas Healthcare. They're doing this to offer on-site, no-cost COVID-19 vaccines to the staff and residents of more than 680 long-term care facilities in Oregon. So you may be aware that the residents of skilled nursing facilities in particular have been among the highest risk groups for dying from COVID-19. And it's very important to us that we vaccinate not only them, and we think the vaccine is likely to work even in elderly populations, but the staff who, have contact with both inside and outside of the nursing home and may inadvertently be bringing the virus into the nursing home. So we want both the residents and the staff of those high-risk facilities to be vaccinated as soon as possible. So their vaccinations are set to begin sometime next week, beginning with the skilled nursing facilities, but eventually these vaccines will be used to vaccinate in a variety of congregate care settings, settings of vulnerable people who are living in the same area, 24/7. And this will include a handful of facilities caring for residents with intellectual and developmental disabilities. So in all, between 300,000 and 400,000 healthcare workers and long-term care facility staff and residents in Oregon are slated to be vaccinated against COVID-19 during the first phase of our vaccination effort. Now, from this week's batch, there's another 19,500 doses left, and they'll be distributed to health facilities around the state over the next several days. More of this vaccine, the Pfizer-BioNTech product, are scheduled to arrive here the weeks of December 20th and December 27th, when we'll get allocations of 25,350 and 48,750 doses, respectively, in Oregon. The 25,350 doses of Pfizer-BioNTech, now scheduled to arrive in Oregon next week, is a reduction from the original amount that we were supposed to get, which was 40,950. These things are changing frequently, and we just got news about this from the federal government today. Now, you may also be aware that there is a second COVID-19 vaccine made by Moderna Incorporated. And the FDA's advisory committee, it's called VRBPAC for short, just met today and voted to authorize the use of this vaccine. So the FDA hears from its advisory committee, and then they're going to make a decision in the wake of this advice. But the advisory committee did say they believed that the benefits of the vaccine outweighed its risk and should be given to persons 18 years of age and older. So we're expecting that to happen. The 2 vaccines are very, very similar, and it's tentatively scheduled to be delivered to Oregon by the end of the month. So in addition to the Pfizer vaccine, we're expecting 71,900 doses of the Moderna vaccine the week of December 20th and 31,700 doses the following week, the week of December 27th. So these numbers are given to us by the Federal Centers for Disease Control so that we can plan, but they are subject to change. They're not written in stone. So if we get the allocations that we expect to receive, we think that the health systems will have enough vaccine to provide the first dose. So both of these vaccines are 2-dose series, but we'll have enough to provide the first doses to more than 100,000 healthcare workers and long-term care facility residents by the end of December. Now, what we know about these vaccines in general, and as I said, they're very similar, is that they seem to be highly efficacious. They've both undergone trials, one of more than 43,000 subjects and the other of 30,000 subjects. And the data suggests that the first vaccine is 95% efficacious, and the second vaccine, Moderna, is 94% efficacious, so very similar. And they appear to be very safe. So both of them underwent rigorous phase 3 clinical trials. They followed subjects for an average of 2 months. And most of the people who experienced side effects had local side effects, as well as some what we call systemic side effects, like some fever, chills, muscle aches, headaches. They tended to be mild to moderate, and they only lasted a day or two. So if you get one of these vaccines, don't be surprised if you start to get some muscle aches or something like that, but be reassured that they tend to go away in about a day. They did not see many serious adverse reactions, the kind that would make you seek medical attention. So that, despite the tens of thousands of people who are vaccinated. So that's very, very reassuring. And of course, as the vaccines are rolled out and more people get them, we'll be following to see whether additional side effects are identified. So, as we've said, we don't have enough vaccine to immunize everyone. We have a limited number of these doses, and other states are looking at this as well. And we're going to vaccinate the healthcare workers who are exposed continuously and who we depend upon to take care of patients, and those very high-risk people in the long-term care facilities. But we expect that the vaccine supply is going to increase over the next several months, and hope that ultimately we can vaccinate a large share of our population later on down the road in 2021. Director Banks.
Thank you, Dr. Cieslak. So just a little bit more about our process for vaccinations. As Dr. Cieslak talked about, there is the 1A population. So the Centers for Disease Control gave some recommendations about how we might go about phasing or sequencing, if you will, how Oregonians got vaccine. We're clearly starting with healthcare workers. We have a broad definition of that based on our equity principles, which include healthcare interpreters, which include traditional health workers, and which include people who are taking care of our neighbors who have physical and intellectual and developmental disabilities. After that, there is the CDC recommends looking at what's called phase 1B, and that is for critical workers. We're going to call them critical workers here in Oregon. If you're looking at CDC literature, you may see the word essential workers. And what our goal is right now, we are assembling a vaccine advisory committee. Applications have been out. We've received phenomenal interest, over 600 applications. We're reviewing those applications now, and we'll be making announcements next week, and then working with the advisory committee to put in place principles, equity-based principles and ethical-based principles, and how to make decisions on how to sequence the prior groups. So critical workers, and then we'll also be looking at in next phases, those Oregonians who have underlying health conditions or other health considerations, as well as our elders. And then we know in phase 2 and 3 that as the vaccine becomes more readily available, that we'll continue to vaccinate people until we get to general population. People often ask, when exactly will this happen? We want to caveat that we don't have all the information yet from the federal government on when we'll be getting vaccines and how much. We know about the doses that we are supposed to receive this month. And as Dr. Cieslak said, if we have about 400,000 folks that we estimate are in the phase 1A population, and we receive about 100,000 doses, that we know if we kept going at that rate, it could take us quite some time. So we just want to let folks know that there's definitely this light at the end of the tunnel for sure. We're so excited about the arrival of vaccinations in Oregon this week, but it's going to be a long tunnel, and it might be windy at times and have some potholes in it, but we know that we're going to get there, and particularly with you all's help in taking these actions that have really continued to help our cases level off. With that, I'm going to turn it back to Dr. Cieslak to talk about and address some of the questions or concerns that we've received about the vaccine.
Oh, right, thanks. So, probably the question that we get most commonly has to do with whether the vaccine is safe and effective. And it's totally understandable to have questions about whether a new vaccine against this new disease is going to work and what the side effects are. And I have to say, I've heard some rumors flying, so I want to tell you what we know. I want to say up front, though, that I think these vaccines are pretty impressive. From the data that I've seen that have been presented to FDA and to the Centers for Disease Control, they look like they work really well, better than most vaccines. To get 94 and 95% efficacy is more than your average vaccine gets. I think measles is probably that good, but most of the vaccines that we recommend are more like in the 80 to 85% range, or sometimes even less. So 94, 95% is actually very, very good. And they look to be safe, and I intend to get my shot as soon as my turn comes up. Some of the vaccine side effects might seem similar to those that COVID-19 causes, right? So why should you get the vaccine? Why not just get the disease? Side effects like fever or chills or sometimes headache or muscle aches or things like that. The vaccine can do this. It does it in 10 to 15% of people. But the difference is that COVID-19 can go on to attack your lungs. The side effects from the vaccine tend to go away within a day. But if you have COVID-19, several days into it, you start to get short of breath. And, as you may end up in the hospital and even in the intensive care unit. So COVID-19 is definitely the longer lasting and much worse thing. We have not heard about side effects from the vaccine that are actually going to affect your breathing. There's also a risk of death if you have COVID-19. About 1.2% of all the cases reported in Oregon to date have died, and a much higher percentage have died among the elderly persons. So after tens of thousands of persons have gotten the vaccine in the clinical trials, we don't know of the vaccine causing any deaths among all of those persons in the trials. So what I would say there is that, yes, the symptoms might start off the same, but the outcomes are very, very different between getting COVID-19 and getting the vaccine.
Thank you, Dr. Cieslak. And I know now that we have questions, and we're excited to get to those questions. We are hoping to take COVID-19 vaccine-specific questions right now. And I know, Jonathan, you're going to read us some questions from viewers.
Yes, thanks, Rachel. My name's Jonathan Modi, and we have a few questions that I will start with. Victoria asks, can vaccinated people transmit COVID to or infect non-vaccinated people? I heard the vaccine stops symptoms, but not transmission.
Okay, great question. The answer is it's too early to tell because we haven't collected a lot of data on whether vaccinated people can actually harbor the virus and transmit it to other people. I will say today, though, that I'm very hopeful that it will stop transmission for two reasons. Number one is we think you're less likely to transmit if you're not coughing. And the second reason is that at least with the Moderna vaccine, they did test people after one dose of the vaccine, one of the two recommended doses, to see who was harboring the virus. And there were many more people. I think it was 30 people who had gotten the placebo had the virus, but nobody who had gotten the shot had gotten the virus. I'm not sure about those numbers, I'm sorry, but it was clearly a difference between you were less likely to have the virus if you had gotten the vaccine. And the other reason just has to do with how the immunity from the vaccine works. It attacks the virus's ability to invade your cells. And if the virus can't invade your cells, then I think it's unlikely to multiply in you and be transmitted to someone else. So I'm very hopeful that it will stop transmission.
Okay, thank you, Dr. Cieslak. Sue asks, will categories or groups, for example, people by age or profession, be announced so folks know when to go to their doctors or pharmacy to receive their shots?
Yes, that absolutely will be announced. Once we work with the Vaccine Advisory Committee and make determinations based on the allocations that we get, we will be announcing that in various channels in various languages and working with community-based organizations and our local partners to make sure that we get the word out and folks are able to get their vaccine when it's their turn.
All right, thank you, Rachel. So Jen asks, how long will the vaccine protect someone from COVID? How often does it need to be re-administered?
Great question, and one that we get a lot. Again, we don't know. Most of the subjects in the trials were followed for 2 to 3 months, and the vaccine is protective for at least that long. We're hopeful that it will protect longer, but until we've had a chance to follow people for a longer period of time and see whether they're coming down with illness, we won't know for sure.
Okay, thanks, Dr. Cieslak. So Michael asks, what happens if we don't get 70% of people to get the vaccine?
Okay, so we've been estimating that it's going to take at least 70% of people in order to get so-called herd immunity or community immunity, where the virus really can't find the next susceptible person to infect, and therefore the disease eventually goes away on its own. If we can't get there, then the virus will continue to spread and we'll continue to see serious illness among people who aren't protected, and especially the vulnerable populations. So ideally, we would get to the point where just about everybody is protected and the virus goes away.
Thanks, Dr. Cieslak. Savannah asks, will the side effects from the vaccine be the same in a healthy person versus a person with underlying conditions like diabetes or hypertension?
They seem to be pretty similar. They did have a lot of patients who had underlying conditions in the clinical trials, and they didn't notice a lot of difference in the side effects. I will say that younger people tend to react a little bit more. So younger persons tend to get a little bit more of the muscle aches and fatigue than older vaccine recipients did. But otherwise, it seemed pretty similar.
Thanks, Dr. Cieslak. Jennifer asks, is the vaccine live or dead?
It's dead. All the vaccine is a piece of the genetic coding material for the virus. It's a pretty ingenious technology. The coding material goes into you. Your cells will make a viral protein for a short period of time, and then your immune system will respond to that protein and develop a protective response. So you're not getting any live virus at all.
Thanks, Dr. Cieslak. Teresa asks, I've already had COVID. Should I still get vaccinated when it's my turn?
Boy, that's a good question. I will say that the feds kind of hedged on this one. They said you probably don't need it for at least 90 days. And that's because we have pretty good information that suggests that after you've had an episode of COVID-19, you probably won't get another one for at least 90 days. It may be longer. It may be that most people are immune for much longer periods of time. But you could put it off for at least 90 days. But they also said it's okay to get the vaccine if you're in one of the high-risk groups, just in case. They did have some people in the trials who had evidence of COVID-19, and they vaccinated them anyway, and they did not see any difference in side effects between the people who had previously had the disease.
Thanks, Dr. Cieslak. Bob asks, is it true the FDA has not approved the COVID vaccines, but merely authorized them for emergency use? What's the difference?
That's true, and that's a great question. When they authorize it for emergency use, what they're saying is it appears that the benefits of the vaccine outweigh the risks, and so it's not formal approval, and they have to when a doctor administers it, the doc has to give you the statement about the risks and benefits and get your consent to receive the vaccine. So it is kind of a preliminary step. It's not full approval. Full approval means any doc can give it to anybody, but this is not that. It has to be used for only persons in these age groups, and after you get the patient consent. So the vaccine manufacturers are intending to apply for full approval some months down the road, but there are some additional steps required, like they have to look into how long the product lasts on the shelves and things like that.
Thanks, Dr. Cieslak. Sarah asks, will kids be required to get the COVID vaccine to go back to school when schools open for in-person instruction?
No, the vaccine hasn't even been tested in kids yet. And as you know, children are at very low risk for getting serious illness from COVID-19. They can get it, but they're at low risk for serious illness. So I will say that's not even on our minds for both of those reasons.
Thanks, Dr. Cieslak. Darla asks, how will healthcare workers who don't work at hospitals or clinics receive the vaccine?
I'll say there's a number of ways that we're have been working to make sure that healthcare workers get it. Obviously, if you're connected to a hospital system, but if not, if you're connected through another site, this includes outpatient settings or with your trade association. We'll also be working with our local public health and other folks locally to make sure that we have clinics open in a variety of different ways for healthcare workers who may not work in a hospital to become vaccinated.
Thanks, Director Banks. Peter asks, do you have any estimates for vaccine deliveries in January and February?
I haven't seen any. Have you, Rachel? No?
No, we do not have estimates yet for January and February. We have estimates for the first 3 shipments, so the first weeks in December.
Thanks, Director Banks. Peter asks, excuse me, I'm sorry. Gray asks, will the vaccine be available at no cost?
Yes, so the vaccine has been paid for by the federal government, and including the supplies. So it's anticipated that it'll be at no cost. We do think that there may be some charges, administrative charges that may accompany a visit or what have you, but those should be reimbursable by insurance and by Medicaid. So we're working through that to make sure that the vaccine can be at no cost for patients and community members getting that vaccine.
Thanks, Director Banks. Joseph asks, when someone is given the vaccine, do they need to remain isolated from the general public for a certain amount of time?
No, they're not getting the virus, so they're just getting the protection from the vaccine. They don't need to be isolated.
Okay, thanks, Dr. Cieslak. Alvina asks, my elderly parents live in an assisted living facility. Are both the Pfizer and Moderna vaccines effective in elderly people? Is one more effective than the other?
They both do appear to be quite effective in elderly people, which is really good news. And the effectiveness seems to be very close. As I mentioned, overall, 95 and 94%. And there weren't really big differences based on age. And so I would say get the first one you can get.
Thanks, Dr. Cieslak. A follow-up question to that is, will people have a choice?
It's possible that you won't. I think you'll probably have to get the vaccine that your healthcare provider has in stock and is able to give you, at least at this stage of the game. Director Banks, do you know otherwise?
That's my understanding as well at this point, that most of the locations that are getting allocations are getting one or the other. At this point, it's Pfizer, and then as Moderna comes out, that will be assigned, and it'll be one or the other. There may be some rare cases where a provider or a long-term care site has them both, but we don't think that will be the norm.
Okay, thank you both. Maria asks, if a person recently got a flu shot and then they get the COVID vaccine, will this cause a strong reaction or complications? Has this been seen in clinical trials?
Well, the clinical trials were just giving the COVID-19 vaccine, and it's currently recommended that you not receive another vaccine at the same visit. So that's the recommendation, and I can't say whether you would have a more serious reaction if you got both of them at the same time.
Good, thanks, Dr. Cieslak. And the last question is from Matthew. What's your best guess for when we'll get to Group 1B?
That's the $1 million question. And you know, I don't know, Dr. Cieslak, if you have a guess. I will say that I think it could definitely be through March before we got through 1A. And so we want folks to have patience as we walk through this tunnel, but keep our eye focused on the light at the end of the tunnel. I don't know if you have anything else, Dr. Cieslak.
I think that's about right.
Okay. Well, thank you both, Dr. Paul Cieslak, Director Rachael Banks. We really appreciate everyone joining us here for this Facebook Live. If you have any other questions, please continue to pose them on Facebook, and we will work to respond to them. And with that, we wish you a great rest of the week and a great day, and happy holidays, and take care of yourselves.